we need to end this practice of getting on Facebook or Craigslist and having people find childcare through some random person. That's not safe. That's not good for anybody. We have people who are planning pregnancies around when childcare slots are open. That's not how we want to operate.
Access to affordable quality childcare in rural areas is often difficult, if not impossible, to find. However, studies show that access to childcare is vital for long-term viability of rural communities. K-State Research and Extension Child Development Specialist Bradford Wiles, Pottawatomie County Family and Consumer Sciences Agent Erin Tynon, and Pottawatomie County Economic Development Corporation Executive Director Jack Allston have been working with a local task force to conduct a child care needs assessment to identify barriers and find solutions to improving child care in rural areas. On today's Sound Living, investing in rural child care. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Wiles, the lead researcher on the project, used a community-based participatory process that included Pottawatomie County Economic Development, K-State Research and Extension, and other local partners.
We had key stakeholders get into informing how we did this work, everything from what questions we asked to how long those questions were going to be, to then also recruiting people to talk with us about getting information. And then with Jack and his contacts and Erin's as well, I really came on fairly late in the process. I was sort of a late add-on to really help deliver what it was, the vision for figuring out what rural communities in Pottawatomie County in particular need when it comes to access to quality, affordable childcare.
And Jack, you and Erin were able to identify early on the need for not only childcare in Pottawatomie County, but quality and affordable childcare.
Yes, we did this early. Started in 2015. Erin actually brought the idea to me. I'm an old consultant in the site selection field, so I knew that childcare was a big issue and a big factor. And she accentuated that, and then we formed this child care task force. I think it was the end of 2015, and it just kept moving along. And thanks to Erin and the members of the committee, which included child care providers, we were able to get Bradford in and get this survey. And it was Bradford's work in getting the grant and getting it moving along to where we did get the response, which was significant, and then getting the results that this is definitely a big issue in all rural counties across America, not just Pottawatomie.
Erin, maybe a little background on your role in this project.
Yeah, so I've been in Extension in Pottawatomie County for about 6 years, and I think one of the things that Extension does really well is teaches you about the importance of relationships and building relationships with stakeholders and those in your community. And from the time I started, this was mentioned to me several times just by people coming into our office for other services, because childcare affects everything that we do. And so it was always something in the back of my mind. I'm probably a little bit more sensitive to it because it is some of my background. I have been a childcare surveyor and I have a degree in early childhood education. And so I know its significance, but it was just through conversations with Jack that this really developed.
So when you did the survey, who were you surveying and what were some of the things that you learned?
I can't emphasize enough how much this was directed and guided by the Child Care Task Force. So we ended up looking at 4 main groups with a 5th one that I'll talk about just briefly. So the number one priority were those adults who were seeking child care. We then looked at those, this was all simultaneous, but in terms of order, those who currently have child care. Then we looked at the general public, anyone who was not either looking for care or currently had care for a child. And then finally, we also had another group of child care professionals. So looking at the opposite side of the consumer and provider relationship, looking at what child care providers need, their resources, what their wait lists look like, what their capacity are. We learned a ton of things through that process that have really guided how we've started to frame our future direction, in particular around infant care. And then finally, and I want to point out Jack's role in this as well, we had a focus group that included human resource managers that were in both Riley and Pottawatomie County that really helped inform that dual role of professional and parent, not only their organizational struggle with recruitment and retention, which is a huge economic development issue, but then their own personal struggles with trying to work and find access to quality, affordable childcare.
Yeah, that group was pretty significant. Now, I had done interviews with major employers in the Pottawatomie, Manhattan region in 2014 and had been talking to them through 2018 when I did another set of surveys. So we know who they were that are having significant problems. And this included Kansas State University's Human Capital Services, who were kind enough to participate in those meetings, as well as the city of Manhattan and others that have significant issues with lack of childcare. And since we started as a task force, we've had 3 child care centers open. Well, 2 and 1 will open. 2 of them are in Blue Township, so they're servicing Manhattan. But the other one is going to be in Onega on property owned by the hospital, but built by a developer who is going to have his family operate the child care center in Onega. And they're going through all the proper proceedings right now, and the building is being built right across from the hospital, right in the middle of town. So that will help service that population that didn't have a provider before. But we're also looking at training funds, because the other issue that the providers have is being able to hire quality child care workers and be able to retain them.
And that's such a huge part of what we learned through this process, balancing what families need with what our current child care providers can do, and frankly, why can't they expand? What are the barriers there? And being able to pay a living wage. So we are looking for funding to provide continuing education. So getting people who are in the field already even more qualifications, so bachelor's to master's, or some have an associate's with enough time in a classroom to be able to provide care. But again, the pay scale for that is much lower. And so what we want to try to do is not only provide the in-service hours, which are the Kansas Department of Health and Environment's requirements for being a professional, but also really adding value for the child care providers in terms of their staff. There are a few things that we figured out. Happy workers are good workers, and people who see opportunities to learn and grow in their careers will tend to stay in those as well. And then the return on investment for early childhood is really strong. We talked earlier about the recruitment and retention element, but that's only one of them, right? So there's another element of the workforce itself of child care providers. Those are jobs. But then there's the other element of essentially raising the next generation of people who are going to work in your community, right? And in a lot of rural communities, people will stay there if they can. And then the final thing that I cannot emphasize enough is the loss of productivity as a result of access to quality, affordable childcare is felt profoundly in rural businesses, where the time that it takes to go to and from any pickup or drop off that's unexpected, right? The inability to make quick shifts due to the rural element. Oftentimes a neighbor is 15 minutes away, right? And so there are a number of those things. And then in talking with a lot of the employers in Pot County, a lot of the sick days that employees are taking are not really their own sick days. They're child care providers sick. You know, their mother who cares for their kids is sick or needs to go out of town or whatever these things are. And so those are the kinds of things that we really want to try to address.
Do people want their children in a larger setting? Do they want them in a smaller setting? Is there a break point as to how much they're willing to pay? Where do we stand on that?
So the answer is most people want their children in a center. However, most people in Pottawatomie County do not have their kids in a center. What we found was if you were making less than $60,000 as a household, 2.5 times more likely to be looking for childcare. So because our data is cross-sectional, we don't really know if that would be higher because of the opportunity cost of caring for kids. But we know that if you're making less than $40,000 a year, odds are very high that you do not have childcare, and that even if you could find it, you likely could not afford it.
What's your next step then? Where do we go from here? How do we try to put this into action?
Yeah, so the first thing is we continue to leverage these partnerships. So with the success in getting things rolling in Onega, that Jack and his team, in conjunction with the entirety of the task force, has really gotten going. That's the first thing, is to really use that as a template for how do we get this done. The second thing is to recognize that we need to reconceptualize how we think about childcare. We need to start thinking about childcare as an investment, as a utility, much like internet access or phone lines or electricity, right? That for rural communities especially, not having any of those things that I just mentioned is anathema. You simply can't have a community. When it comes to childcare, that's essentially the same thing. You're going to age out, for one thing, and you're not going to be able to recruit and retain the people that are necessary to bring that community vitality to you and bolster it and help it grow. We talk about partnerships in a general sense, but this as an actual model. So these people, your main child care providers, your economic development corporation person, your extension FCS staff, your Kansas Department of Health and Environment surveyor, after school programs, the actual individuals. Then there's also, and I think this is the real power in the work, is recognizing how important getting the information about your community is, because nobody's funding hunches anymore. And so being able to say, hey, we know about our county, we know about our community, is so useful. It raises the level of conversation from I think this or we believe that to we know this. And that's a huge part of the model.
And Erin, from your perspective, what kind of things can you do as an extension agent to ease the problem moving forward, at least somewhat?
Yeah, so sharing it is the biggest thing. I felt like when we were distributing the surveys, I got a lot of, oh, I'm glad someone's finally looking at this. You know, this is positive. Something needs to be done about this. So right now, just kind of distributing what are these saying and what do we need to do moving forward, and just keeping up the positivity in those relationships that we have that have helped contribute to this compilation of data, and keep working on these issues. I think the fact that we've had some child care providers open up in this past year has been positive, and is a move in the right direction, but also just the child cares that we currently have, addressing some of their issues that they have with staff retention, pay, and education is really important too.
Yeah, I would just say that there are three main takeaways. The first is these are not an individual responsibility issue. When we do well, we all do well. When we look at what access to quality, affordable childcare in Pot County can do for it, it's a no-brainer. It's a good investment. Fortunately, with Jack and his colleagues and leadership in economic development in Pottawatomie County, they understand that. And that's one of the big models we want to convey as well, is that it really helps when the people who are in Jack's position understand how important that is. So that's the first one. The second thing I would say is we need to end this practice of getting on Facebook or Craigslist and having people find childcare through some random person. That's not safe. That's not good for anybody. We have people who are planning pregnancies around when childcare slots are open. That's not how we want to operate. And then the final thing I will say is funding can be extraordinarily useful in targeted and sustainable efforts. I think we want to move from exploratory to sustainable, and that's the big push coming, is to get that community and municipal, state, and federal support to come together and make this a reality for families.
Ultimately, Wiles says the success of the project will be measured by whether communities are able to use the model to build and sustain a facility or facilities that respond to their need for access to quality, affordable childcare. Bradford Wiles is a child development specialist with K-State Research and Extension. Erin Tynon is the Extension Family and Consumer Sciences Agent for Pottawatomie County. And Jack Allston is the Executive Director of the Pottawatomie County Economic Development Corporation. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.